It's an illness that seems to be causing paralysis in children. It's now impacted 75 children across 29 states. However, the Centers for Disease Control, they still don't know what the problem is. So parents, how can you protect your children? We're going to turn to our CNN medical analyst, Dr. Seema Yasmin, also a former disease detective for the Centers for Disease Control. So we need you to use your detective skills here for us. Dr. Yasmin, I understand you've spoken to the CDC and have the latest information about the number of children that are affected. Are we up to date on the numbers?
That's right. We've seen the numbers steadily increasing since we first heard about this medical mystery in September. And as of yesterday, it's now 75 children across 29 states who've become mysteriously paralyzed overnight. These were normally healthy kids, but they have noticed one thing here, and that's that in either the few days prior to them becoming paralyzed or maybe 2 weeks before they become paralyzed, they've had some kind of respiratory illness, some kind of fever illness. So there may be a link between that and between them becoming paralyzed.
Is there we've been hearing so much about this enterovirus. Is there a connection to that?
So the CDC said there could be a connection, but right now they haven't proven that. And they're doing their best to keep a really open mind so that they can cast a wide net and try and figure out what exactly is causing this. They said it probably is an infectious cause, probably most likely a virus. But as I said, they're keeping an open mind just because at this point it could be anything.
So if you don't know what it is, how do you work then on treating these really sick kiddos?
You stay really, really vigilant and you make sure that you get the message out there to healthcare providers across the states. Let parents know as well, as we're doing right now, that if your child suddenly becomes weak, you notice their arms or their legs are not working as they normally do, or their facial muscles are drooping, their eyelids are drooping, for example, get them to a doctor. The other thing that we can do is, because we're in flu season now, it's that time of year when lots of bugs are going around, especially among children, make sure they stay home from school if they have any respiratory illness. Keep them away from other sick children and make sure they learn to wash their hands really well.
Really good points for parents and any caregivers of children to know and understand and practice. Here's the question. Once those children are taken to the hospital, how are doctors treating them? Are they able to recover from their symptoms? What kind of care are they getting?
Sadly, the kids who were first diagnosed at the beginning of this outbreak around early September, none of them have made a full recovery yet.
Goodness.
I've heard that some of them are making some improvements, but none are back to their usual selves. So really what they are doing right now is they're deep into this investigation, working with doctors across the country, trying to find out what exactly is causing this. Once they know that, they can try and stop it in its tracks.
Why is this such a mystery to us? You'd think with all of the accomplishments that we have made and the success and the breakthroughs that we've made in medical investigation, and you know this very well, we would be much more able to figure out what this is and get to the heart of it.
Sometimes diseases are just a lot quicker than we are, sadly. And also you have to realize that nowadays we seem better at joining the dots. So maybe this outbreak could have happened a few years ago, but we may not have been as good as recognizing that all these cases were linked. There could have been one case in Colorado, one case in California, a few in New York State, and we wouldn't have pieced all those puzzles together. So now we're better at detecting outbreaks, but still it takes a lot of work to find out what's the actual cause.
And look, the number's low. It's 75 kids, but to be honest, we all agree that 75 kids is 75 kids too many.